Welcome to the last session of this incredible Breaking Barriers 4-week symposium. We are honored and blessed to have with us next for our last session, Dr. Senator Pan, who has a great history in public health, obviously by being a doctor, and has been incredibly supportive in legal issues about having to do with any kind of legislation for health. And most of my contact actually with Dr. Penn has been about Medicare issues. And since we were just talking about Medi-Cal, Medicare funding, he has a background in all of that. So without further ado, we have invited him to once again address the Breaking Barriers group. If you do have any questions, please put them in the chat and I'll be monitoring those so that by the time we get to the end of this session, I'll be able to help address those, and then we'll wrap up by the end. So thank you again, Dr. Pan, for coming, and welcome.
Well, thank you. Thanks very much, Maureen, for having me here. And I want to thank all of you who are participating in this very important conference about our kids here in California. And certainly COVID has had a tremendous impact on our children, as well as, of course, everyone in our state. We're still, unfortunately, right now we're in a period of time where the cases are rising, particularly in the Midwest in our country, but also here in California as well. And while we're doing better in the rest of the country, we are part of the United States. And so when things happen in other parts of the country, they do end up happening here as well. So what I thought I'd do is perhaps touch on some of the things that we are doing and looking at, particularly in relation to COVID, because that is sort of the crisis that we're facing immediately. But we also have other things going on as well, like wildfires, but also recognizing that the fundamental problems that were happening before COVID haven't gone away. So even though we do have this COVID crisis that might have highlighted some of those even more, that certainly recognize that even before COVID, we had issues we had to address. So I thought I'd touch on several issues, and then certainly very interested in hearing some of your questions as well. One of the areas that work on in my office is actually around food insecurity. So we've been doing the Million Meal program here in Sacramento for several summers. This year, actually, schools are delivering meals, so we didn't do the program this summer because there was the meal distribution program that school districts were doing, were already covering a lot of these things. But we do know that many families are suffering from food insecurity, and that in fact we just had a hearing of the Human Services Committee, which I sit on this Monday on actually on food insecurity. I think it was Tuesday, on this very issue, and talked about in terms of basically how do we make it easier for people to not only enroll but stay on CalFresh, especially since for people that we want people to shelter in place, but yet they need to check in with their eligibility workers and so forth to stay on the program. We also talked about the issues on the summer meal programs, or actually the school meal programs, and how we continue to support those as well. But also recognizing that, for example, because unfortunately of the public charge rule, there are families who do not feel comfortable signing up for programs like CalFresh. And so their children may be, U.S. citizens, but because they're a mixed household, they're afraid of signing up. And that burden often then falls onto the food banks, who, of course, are not just dealing with people who may have challenges getting onto programs like CalFresh, but also in the general community. And so certainly our food banks have been stretched as well in terms of being able to serve larger populations, including families with children. So trying to figure out how we provide additional support for all these different components. And we have passed policies to make CalFresh enrollment and re-enrollment easier and more available by remote means, as well as trying to find ways to provide more supports in other ways as well. As we're all holding up at home, our kids certainly can not only observe the behavior of people, their parents and other people in their family, they themselves are directly suffering in terms of not being able to go to school or go on play dates or being able to mix up with other folks that their peers. And so mental health is certainly a significant challenge for our children as well as their families. And we need to think about what are some of the things that we can try to do to help those families. That's been an ongoing conversation in terms of improving mental health access for children and better cooperation between counties and school districts to try to provide mental health services. But certainly now this is a very significant issue in terms of trying to be sure that that basically families and children are able to get access to mental health services. Unfortunately, another piece to this, though, is that, and again, we had a hearing in the Human Services Committee for our foster children. So not only, of course, mental health access, but also being sure there's been a significant drop in reports around child abuse by mandated reporters. And unfortunately, that's probably not because there's less child abuse going on, but because there's fewer contacts children having with teachers, with doctors, with other people who may be mandated reporters who also could be looking out for these children. So that's, again, another issue, as well as, of course, for the kids who are in the foster care system, in terms of the follow-up from the social workers and other types of people as well. So that those are ongoing issues that we've been looking into, and again, trying to figure out how to address these particular issues. And then, of course, let's talk about education, right? And we made reference to it in terms of mental health and other things. A lot of school districts, unfortunately, are not able to open because of COVID. We're still trying to figure out how to, what kind of parameters we need to put in place for schools to open safely for both the students and the staff and teachers who work in the school, and then, of course, with the family members that are going back home to. And so that's a significant challenge for our teachers to do distance learning. But then, of course, we're particularly we have many children who live in households where they don't have good digital access, and even if they do have internet access, their broadband may be too slow, or there's data caps, right? And then, of course, there are families who just don't have internet access at all. So this, in terms of being able to do distance learning, we need to be sure that students have access to not only broadband, but sufficient broadband that will allow them to access education. We do have a constitutional right to an education in our California Constitution. And so I think we need to figure out how we meet that constitutional right in the time where with COVID and where we are relying on distance learning. And even school districts are looking at in-person learning. If they're doing hybrid models, people still need broadband access. But unfortunately, at this stage, as if you've been following the governor, we're kind of moving all back to purple in most of the state, and so that means that that means the schools are unfortunately not going to be opening anytime soon. But certainly, we look forward to a time when students are going to be able to have more in-person interaction. But we again need to get control over this pandemic. The other thing that also we noticed that happened is that children aren't getting the regular checkups. So we talked about decrease in reporting, interaction with mandated reporters. One group is actually the primary care doctors, right? They're pediatricians, family physicians, nurse practitioners, et cetera. So we've seen a drop in visits, particularly well child visits where screening's done. We've seen a decline in vaccination rates associated with that as well. It's certainly understandable that families are somewhat fearful of potentially getting infected, and the practices themselves have had to figure out how to reorganize the way they do things to be sure to assure protection for the children and the families who go visit their practices. Certainly, there's been a lot of work to try to help support physician practices so that they can do this. The costs go up when that happens. the capacity goes down because they have to, in terms of they can't have a bunch of people sitting in a waiting room. And then of course, moving to telehealth as well, and allowing more care to be taking place in telehealth. So certainly some of that can be done over telehealth, but we also have challenges in terms of certain things do need to be done in person. So how do we go about doing that? And of course, that affects our mental health system as well in terms of mental health. So doing more mental health over telehealth, but also recognizing that there may be some things that can't be done as much over telehealth. And then ensuring that people still continue to have healthcare coverage. So are they not able to see their doctor because they lost their healthcare coverage because they got laid off in their job, right? So the economy has been struggling, and unfortunately, excuse me, many businesses have been struggling, particularly small businesses. People who either own those businesses or employed by those businesses are impacted, and that could also impact their healthcare coverage as well. So, so certainly, the good news is that we have not seen as much of a rise in the Medi-Cal enrollment or caseload as we expected, but we anticipate that's going to continue. Certainly, we've been continuing to support Covered California for those people who still have income, but need more assistance in terms of getting assistance for getting health coverage. I should point out that the open enrollment for Covered California is happening now, just started. And so for people who they're still making income through their business or through employment, but need assistance, they can look to Covered California as well. But we've certainly implemented several emergency measures to streamline eligibility determination for Medi-Cal. And of course, there's been support to try to figure out how do we reach more people. One thing I would make note is that the CARES Act, which provided funding for many programs, those funds will expire, I believe, toward the end of the year. And that's going to be a challenge for our state and local government as well. And that's why we continually call for the federal government to step up, and that there's need for additional stimulus to help our families and our businesses, and be sure that we need to continue to provide those supports as well. And one of the things we were working on prior to COVID, it was our Medicaid waivers and the CalAIM initiative. That while that's been delayed because of COVID, the governor has stated that we're going to continue to move forward with those. So that's, again, one part of the conversation is about how do we better integrate our care? How do we better try to address through our Medi-Cal system, basically more comprehensively address sort of the complex health and social issues that impact people, particularly people with the highest needs in the Medi-Cal program. But again, this is an ongoing conversation that needs to happen, including with, of course, our federal partners, because they have to approve the waiver. And so we'll see how the Biden-Harris administration will interact with us in regards to those waivers. But initially, we thought we would be dealing with the Trump administration. But since we had an extension on our existing waivers, we'll see how those go forth. So again, a lot of different issues out there. And then I should just probably step back and say, of course, this is in the context of a state budget that's challenged by COVID. We as a state cannot have an unbalanced budget. We can't borrow to fund our programs in the same way like the federal government can. That's why we're very dependent on the federal government. Our health programs, 70% of the money comes from the federal government. In terms of the CARES Act and other types of things like our employment and so forth, a lot of that comes from the federal government. And we ourselves as a state, well, we can try to do, we're a big state, but we do have certain limitations on what we can do financially, and especially with our revenues being down because of COVID. Although, again, the most recent LAO report has indicated that we're doing better than we thought we'd be at this point in time, but it's not a long-term thing. It's perhaps a one-year bump. that we set of funds that we could work with for next year, we do need to think about how we balance those issues out as well. So I think with that, it's be very interested in hearing what you want to ask about and issues that you want to raise. But again, thank you so very much for having me, and I look forward to hearing from you, and of course working with you in this coming year as we try to be sure our children are taken care of, and that we try to minimize the impact of COVID on them and their families. Thank you.
Thank you so much, Dr. Pan. What you've done for us is give such a big picture of all of the many, many, many things that that you need to deal with every day and that impact all of us, and particularly our children. And given that this is the Breaking Barriers conference, part of the issues that we've been discussing over these last 4 weeks have been basically these silos, these different systems, and you mentioned actually several of them. So our first question says, from the four, it says Breaking Barriers conferences, but I think he means these last 4 weeks. It's clear that we have a lot of organizations here in California, all of which are trying to help, but they may not have shared goals or aligned services. So do you have some recommendations about how we could get better shared aligned services to happen?
Well, I think it's challenging in terms of, right, we have these silos, and some of the silos are formed because those are, they're big programs, right? And then the other part is that depending on how the funding streams go. So for example, as I mentioned, there's a lot of federal matching money for programs like Medi-Cal or CalFresh, or, if we talk about schools, it's school districts. And so what happens is that each has their own sort of funding flow. And so while we think that we should be figuring out how to better integrate the programs, sometimes these funding flows can make it a little challenging. And also the people who are working with them are used to working in a certain way, right? So how do we bring people together? So for example, let's just talk about mental health in schools, right? And for children. We know that we want to get better mental health access for kids. The schools are an important entry point for kids who are school age, right? And so we have schools, and schools run some mental health over there. And then we have the mental health, which is run by the county and through these county behavioral health plans in their Medi-Cal program for the low income kids. And then you have the state. And so the state's over trying to interface with the counties, and each of the counties, they'll have a certain amount of independence. And then you have to have schools and school districts, right? So even though each county has a county office of education, they have school districts, and they have a different set of funding streams. And then, for example, one of the things I've worked on is how do we get more federal matching funds to school districts, like MA money and LEA, so local educational assistance. So some of that could be used, for example, for mental health. So how do those interface? And then all of that then has to interface back with DC, with the CMS, the Centers for Medicare and Medicaid Services, in terms of waivers or whatever else. So there's a lot of different threads that are out there. But I would just say, I think that first of all, despite all these different funding threads and so forth, the first thing to do is have that conversation, figure out, is there a way we can do it better? I always say, if you have a really good idea, eventually we'll find a way to make the money happen, right? Maybe it's a bit of an optimistic point of view, but I think the first thing to do is this is a gap that we have. How do we close that gap? So, for example, when we talk about mental health in schools, I think, for example, Santa Bernardino County, I think, has been one of the counties that have been figured out how to pull these things together. And we've, been and provide some testimony, some examples perhaps for some other counties to think about. I think part of the challenge is that, of course, doing the integration, and then the other challenge though is actually bringing it to scale. So I'm sure many of the people in this conference have participated and even figured out some solutions that they've been able to implement into their local areas, a better integration, but then trying to figure out how to bring that to scale while other people are looking in envy and like, oh, wow, you were able to do this. How can we do this? So we want to share that information, but also figure out how can we better facilitate it, because certainly it takes a lot of work for this, but do we have to have everyone do it over and over and over again at each locality? Is there a way we at the state can try to help better facilitate ideas that we've been able to prove in certain areas?
Great, thank you very much. Another question is remembering something that you said last year for us, and that was that you thought that maybe we would be able to expand the array of services and supports, particularly as we learn more about the impact of ACEs on our children.
Mhm.
So is there any further thinking that you've done or that we've been able to make changes of at the state level about that?
So the ACES is still moving forward, right? So we've passed in this budget and retained in this budget, even though we had to make, unfortunately, either cuts or not, limit initial proposals to expand funding. We're continuing to roll out ACES in terms of being able to do screenings and incentivizing people to do screenings. But you're right. I mean, what I talked about last year and what we still have to continue to work on is that, well, now that you screen and you find things, what are we going to do with that, right? What's the follow through? And some of that actually does fall into some of the waiver discussions we're having too around CalAIM and so forth. So we do need to think about, okay, so now that we've done the screening and we've identified these, by the way, it's not just children, although obviously a lot of it is focused on children, but even adults, but children who have high ACEs scores. What are we going to do about it? Certainly we have existing programs to address certain things, but we need to think more, again, back to the integration conversation, right? Like so great, we screened it, we've incentivizing people to screen. Now we know we have these kids who have high scores. What are we going to do with that, right? And we just go, oh, well, gee, we should do something. We need to think about how do we support those sort of remediation, efforts at trying to address the impacts of ACEs.
Right. And one thing I can say about this, the Breaking Barriers Symposium, is that we did discuss and share places that those things are happening. And so we can learn from each other. And that's been great. Well, I don't have any other questions in chat. If anybody has any last ones, you could quickly get them in. But otherwise, do you have any last words for us?
Well, I want to thank you all for the work that you're doing. It's certainly a challenging time right now with COVID, but as I said, COVID isn't the only thing going on. We recognize we need to still continue to work on the underlying issues that the things we talked about last year before we even heard of COVID, those things haven't gone away. So we need to continue to work on those, but we do have to recognize that unfortunately COVID is sort of the crisis at the moment. We also have had other crises. I don't want to ignore those too, like the wildfires, and we're still having ongoing issues there. And that's been extremely disruptive as well for many families in the areas where that's happening and surrounding areas as well. So, we need to continue to work on that. I guess I know this isn't specifically related to this conference, but I can't pass up this opportunity to just appeal to people that as we're approaching the holidays, I really, urge people to stay safe. This is not the year to be gathering with people outside your household. So I know we miss our families and our friends, and that the holidays is the time we usually celebrate together. Please try to do that virtually. It's really important that people wear their masks whenever they're around people outside their household. So, if you're just with people in your own household and everyone's fine, I get it. Let's relax a little bit. But we really got to, cut the chains of transmission. The cases are going up right now. We've hit 250,000 dead in the United States today because of COVID. The daily rate is approaching 2,000 deaths a day. Now, the worst is not happening here in California, and people in California, most people are trying to do the right thing. We just need you to continue to do it. Every once in a while, someone may, sometimes things happen and you forget for a moment, but the main thing is don't give up, keep doing it. Let's try to support each other. But let's try to get through the holidays so that we can celebrate next year's holidays with them as well. And so I just sort of feel that I do have to say that we're all in this, frankly, public health is about the fact that we're all in this together and what our individual actions can affect other people. So, do your best. I know it's difficult. But if we all just do our best, we'll get through this. And we do have hope on the horizon with a couple of vaccines that haven't been approved yet, but look very promising. By the way, I should mention though, they're not haven't been tested in children. I think Pfizer may be down to age 12. So they're not going to be approved for children right away, but eventually they will be. But even if we get more adults immunized, that will help reduce the transmission chain. And if we can get the number of cases back down, and by the way, I should mention several countries have eliminated domestic transmission. There's no vaccine yet without a vaccine, so it can be done. Vaccine will obviously help. There's light at the end of the tunnel here, but it's not going to be the vaccine alone. It really is about each of our behaviors. So we know how that works with kids, right? We talk about how we make, right? So that's a lesson the kids can teach us, right? We can all, there's always going to be maybe, so let's all work together, support each other, encourage each other. If we make mistakes, that's okay. Let's keep going, don't just try not to repeat them, and just be positive, encourage each other, and we'll get through the holidays, and hopefully we won't lose too many more people. And eventually, hopefully we'll have some additional help coming later in the year. So thank you so much for having me, and I look forward to working with you. Actually, I too am also, by the way, I know no one asked, I too am waiting to find out what the bill load rules and some of those things when we start our session again. So we'll figure that out too when we get there. But I look forward to working with you and on being sure that we continue to help support our kids this coming year.
Well, that's fabulous. Thank you so much. There is one last question that actually
sure.
very much with what you're saying, and that is, given that we do have a state that's going to continue doing the best that we can, what do you think about the idea of setting some kind of really ambitious goal about maybe within 10 years, no California child would have more than 2 ACEs scores, or some big audacious goal?
I like big audacious goals. I think the challenge is going to be is our commitment to reaching that goal, even if we're not quite sure what the path is. So I certainly, I think that's something to think about. Let me just share with you something I am working on now. That is, for example, we know that many localities and places have identified racism as a public health crisis. So I do plan to introduce legislation to have the state address racism as a public health crisis. Actually, we originally had a resolution last year, but because we weren't doing resolutions, but we're looking at doing it actually as a bill this year, because we don't want to just have a resolution. We actually want to talk about how we're going to reach that. So, but also I should mention with ACEs, I am committed to making sure ACEs is successful. So that means not just screening, but we have to have the follow through. So I think we're certainly going to be having those conversations about how do we support those things. I'm glad to hear you had discussion in this conference about ways we can help children who have ACE, who have a higher ACEs scores, and I want to, and certainly be very interested in getting that information as well and seeing how we can support programs that do that. But I agree. I mean, we should try to actually, the future should be a future where no child in California is, has more than, 2 ACEs, right? That would be fantastic.
That would be fantastic.
That would require us to figure out how we support, families and children, because oftentimes we were talking about doing things at the back end, but we should be really talking about prevention in the front end.
Well, thank you so much for your leadership in all of this. We really appreciate both your attending, your presenting, your being with us, and then all that good work that you're doing for all of us, especially the children of the state. Okay. So thank you again very much.
Well, thank you, Maureen, and thank you again for giving me this opportunity. And I wish everyone a positive, I think I'll say happy holiday, happy socially distanced holiday, and then looking forward to all of us working together with the new year when we have the session kicking off again. Thank you.
Fabulous, thank you. And I just have a couple of words to say, really, from Elizabeth, who is unable to be with us because of technology, but so she has a couple of things that she wants to just make sure that we end with, and that is thanks to everyone who has attended and hung in there, especially for 4 weeks of different conversations here about shared leadership, shared goals, shared governance, shared financing, shared community, shared data. We had major positive conversations about all of that, and we can't do any of these productive, positive next steps without each of you. So we want to thank everyone who has attended, remind you how important you are to the work, and just appreciate everything that you've done. We have made a lot of progress. Breaking Barriers, this is its fifth time to be able to, Elizabeth is trying to say something to me at the same time here, I'm sorry. But this is our fifth year of finishing up Breaking Barriers Symposiums, and so we are going to continue to work, just as Dr. Pan was saying. So we're going to continue to work on coming out with more information to share. For example, Elizabeth is working on a publishable piece of material that she'll be able to get out to us quickly. And hopefully we'll be able to continue to share the work, as well as put all of the recordings on the website and be available to all of you. And I see Richard, are you needing to add something in here at the end as well, Richard? Maybe not. So I'd like to once again just thank everyone for being here and for participating, and hoping that you learned so much about some next steps, because we will go on from there. Steve, maybe you want to wrap up.
Well, just one final thought. Again, add my thanks to everyone, but also to let people know that we're already planning for how we're going to continue this work in the new year, and for everybody should be on the alert. We're going to be following up, because there's a lot that we need to be doing in 2021. So thank everybody, and be safe and be well.
Great. Thank you all.
Bye.
See you next year.